Good afternoon. Thank you very much for joining us again today. I'll start, as always, with an update on the key statistics in relation to COVID-19. 29 new positive cases were confirmed in Scotland yesterday. Now, I'm going to say more about the total number of positive cases in a moment, because from today we are incorporating new data into that total. A total of 870 patients are in hospital with confirmed or suspected COVID-19. That represents a total decrease of 94 from yesterday, but an increase of 3 in the number of confirmed cases in hospital. A total of 18 people last night were in intensive care with confirmed or suspected COVID-19. That is also an increase of 3 since yesterday. And I can confirm that since the 5th of March, a total of 3,909 patients who had tested positive and needed to go to hospital with the virus have now been able to leave hospital. In the past 24 hours, no deaths were registered of any patients confirmed through a test as having COVID-19. So the total number of deaths in Scotland under that measurement, therefore, remains at 2,448. I would, however, stress, as I did last Monday, that although this is clearly hugely welcome and very encouraging, it's nevertheless common for fewer deaths to be reported at weekends. And unfortunately, I do expect that we will almost certainly report further COVID deaths in the days ahead. And as always, I want to emphasise that when we do report these figures, they are not just statistics. They represent individuals whose loss is a source of grief to many. So once again, I want to send my condolences to everyone who has lost a loved one to this illness. I also want to express my thanks, as always, to our health and care workers and indeed to all key workers across the country. The Scottish Government and indeed I think people the length and breadth of Scotland are very grateful to you for the work that you're doing. Now, I'm going to focus on education in my remarks today, but before I do that, I want, as I indicated a moment ago, to highlight some new data that we are publishing for the first time today. Up until now, we've only been able to publish testing results that come from NHS Scotland laboratories. We've been able to report the total number of tests carried out by facilities run by the UK Government, for example, the drive-through centres and mobile testing units, but we have not yet been able to publish the breakdown of positive and negative results. Though I should say, for the avoidance of doubt, the individuals tested have, of course, been notified directly of their results. Public Health Scotland has been working with the UK Government to rectify this issue, and from today we are able to provide daily figures for all tests in Scotland. For example, we can see that of those people tested in the 24 hours up to 8 o'clock this morning, 29 positive cases were confirmed. Of those positive cases, 9 were from tests conducted at UK Government facilities and 20 were from NHS Scotland facilities. So in total, there have been 18,030 confirmed positive cases in Scotland since the beginning of this outbreak. 15,687 of these confirmed cases were tested in NHS Scotland laboratories, and a further 2,343 were tested through UK facilities. Now, I know that some people compare each day's figures with the previous days very carefully. And if you have been doing that, you will have expected the NHS lab number I've just given to be 88 cases higher than it is. And the reason is that where a person has been tested more than once, first at a UK facility and then in an NHS Scotland facility, we've removed them from the NHS figure to avoid double counting of testing. It's also important to stress that including this data from UK facilities does not change the total number of lab-confirmed COVID deaths that we have been reporting throughout. Now, from Thursday onwards, we will be able to provide a more detailed breakdown of test results by date and by region on the Scottish Government's website, and I hope that this information will be helpful in giving a full picture of the progress that has been made so far on testing over these past 3 months. Now, as I indicated, the main issue I want to talk about today is school education. And I want to address parents and young people very directly today. I know and understand that you are deeply anxious, as I am, about the impact of this crisis on schooling. So I want to be very clear today about some of the principles that we are working on and the Scottish Government's expectations as we start to look forward to the new school year. And I hope to leave you in no doubt today about the priority that I and the whole Government attaches to making sure that our young people do not lose out on education or have their life chances damaged as a result of this crisis that we are all living through right now. So firstly, I want to be very clear that it is our expectation that by the time schools return on the 11th of August, and obviously within necessary safety guidelines, councils will have put in place arrangements that absolutely maximise the time that young people spend in a school environment having face-to-face learning. In this immediate period that we're in right now, the Scottish Government will be scrutinising council plans very closely, and where we conclude that all possible steps have not been taken to maximise face-to-face teaching and learning, we will ask councils to reconsider and revise their plans. Innovation and creativity will be required here, but let me also be clear, where there are genuine issues of resources, the Scottish Government will work with councils to address those, and the quality of your children's education will be the absolute priority in those discussions. And then from the 11th of August starting point, our aim will be to return to normal schooling as quickly as we possibly can, recognising, of course, that along the way we must build the confidence of parents, young people and teachers that schools are safe. And I want to be particularly clear on this point. While we, of course, have a duty to be open with parents that none of us right now have a crystal ball and that the path this pandemic will take in the months ahead remains uncertain, it is absolutely not the case that we are planning for blended learning with children learning at home for part of the school week to last a year or anything like it. On the contrary, we do not want blended learning to last a single moment longer than is absolutely necessary. And so we will be working with councils to return schools to normal as quickly as we can. We want young people to be back having face-to-face teaching for 100% of the school week as soon as it is feasible. And to that end, our regular 3-weekly reviews of the coronavirus regulations will now include specific consideration of the evidence and data relating to transmission of the virus within schools and amongst young people. And where that suggests that safety restrictions can be lifted or eased without putting pupils and teachers at undue risk, we will do so. And as part of these reviews, we will ask our International Council of Education Advisors to consider experiences in other countries. We'll also be working with councils to ensure ongoing and enhanced support for any time that young people do spend learning at home. And again, let me be clear, it is our firm intention, as things stand right now, that next year's exam diet will go ahead. We'll also be considering carefully how we work to address, mitigate and make up over time any impact of this crisis period on young people's learning. Ensuring that our children and young people have the highest quality education and that their life chances are not negatively impacted by what we are all living through right now is of absolutely critical importance. And I want to give you my personal assurance that it is central to my and to the whole government's thinking as we plan and steer the country through our emergence from lockdown. Now, before I hand over to the Chief Medical Officer today, I want to end by emphasising again our key public health guidance, because sticking to this guidance right now remains the most important way of enabling us to make further progress out of lockdown, which I very much hope we will be able to do later this week. You should still be staying at home most of the time and meeting fewer people than normal. When you do meet people from another household, please stay out of doors and stay 2 metres apart from them. Don't meet with more than one other household at a time. Don't meet more than one a day. And please keep to a maximum of 8 people in a group. Wash your hands often. Take hand sanitizer with you if you are away from home. Wear a face covering when you're in shops or in public transport. Avoid touching hard surfaces when you can, and clean any that you do touch. You know, all of these basic measures, hand washing, surface cleaning, wearing face coverings, will all help us to reduce the risk as we start to return to more normal life. Indeed, if anything, these measures become more important, not less important, as we move through this pandemic, and I'd ask all of you to bear that in mind. And just as importantly, if you have the symptoms of COVID-19, a fever, a new cough, or a loss of or change in your sense of taste or smell, please ask for a test immediately, and please follow the advice on self-isolation. You can book a test at nhsinform.scot or by phoning NHS 24 on 0800 028 2816. Sticking to these rules, as you can see from the numbers we're reporting each day, has had and is having an impact. By doing the right thing, all of us, we are suppressing this virus, we are saving lives, and we are also creating the firm foundations on which we can take further steps out of lockdown. So my sincere thanks to all of you once again for continuing to abide by these rules and by this guidance. Now I'm going to ask the Chief Medical Officer to say a few words before I hand over to the Health Secretary, who's going to say a word in particular about the publication of today's review on the Queen Elizabeth Hospital in Glasgow. But first, the Chief Medical Officer.
Thank you, First Minister. Today I want to speak about two things in particular in my update. I've been talking to colleagues from across the health service, particularly in emergency departments and in general practice, and all of them are noticing an increase in people attending them. Now, this is a good thing, and I welcome the fact that people are seeking help when they're worried about symptoms and signs that they're experiencing. Knowing who to turn to is critical here, and the NHS Inform website is full of information that can help. None of these services are able to operate normally yet, though, and all will have extra precautions in place to make sure that people with suspected COVID-19 disease are not mixing with others who don't. These clinical areas will also be ensuring appropriate physical distancing is happening across their sites and spending more time cleaning or refreshing PPE between patients to prevent the risks of COVID-19 being spread. Inevitably, these additional public health measures mean that things may be a little more complex or not quite as you're used to. Sometimes it will take a little longer than it normally would, but people will continue to be prioritised according to their clinical needs. I ask you for your patience with staff as they work through all of these challenges. My colleagues have been working incredibly hard for several months now, and they will always be doing their best to help you when you need it. However, I'm disturbed by a number of accounts where staff have been on the receiving end of abuse from people. Fortunately, this is a small minority of people who display this behaviour, but I want to make it absolutely clear that this is unacceptable in our health service. The second thing I wanted to do today was to announce further work that I've tasked a new subgroup of the CMO advisory group to undertake for me. I'm delighted that a dear colleague, Professor Sahari Burns of the University of Strathclyde, has agreed to chair this group. It will comprise public health experts, including the Scottish Directors of Public Health, and analysts who will examine the range of public health threats that may emerge as we approach autumn and winter. Although numbers of COVID-19 cases are thankfully showing a decline just now, we must remain watchful for it re-emerging. One of the high-risk periods for this will be during autumn and winter, when other threats such as influenza may also begin to show. This is a time of year when there are also annual changes in the incidence of other diseases. So this important group will examine these possibilities when considered together, providing advice on steps that should be taken to give early warning of these concurrent risks and actions that should be taken to manage them. I'm grateful to all my colleagues across the health and social care system, research and academia who continue to work with such determination and dedication to help us meet the challenges of COVID-19. It's only by working together like this across the different disciplines, sharing advice, knowledge and innovation, that we will ensure we're in a position to achieve our aim of controlling this disease. And I wanted to thank them again today for their continued service.
Thank you, Gregor. I'll now hand over to the Health Secretary.
Thank you. Effective infection prevention and control is vital to the operation of all our healthcare settings at all times, not simply in the face of the current COVID-19 virus. Last year, important questions were raised around the safety of the hospitals in the Queen Elizabeth University Hospital campus in Glasgow. Patients, families and staff who have been affected by problems at the hospital deserve answers to their questions. That's why I commissioned an independent review and this morning that review published its report. The review, co-chaired by Dr. Andrew Fraser and Dr. Brian Montgomery, found that while the hospital now offers a high-quality healthcare setting, patients, staff and visitors with compromised immune systems were exposed to risks which could have been lower if the correct design, build and commissioning had taken place. Importantly, the report states that since the building's opening, remedial action to resolve a wide range of issues has taken place, some of which are now subject to legal action by the Health Board against some contractors. On behalf of the Scottish Government, I want to express how sorry I am that patients and families have had to endure this situation. And I want to thank the whistleblowers whose courage and resilience then and now has been invaluable to this work, to my work, and to the other work that is underway. Today's report will help inform the forthcoming public inquiry into the construction of the Queen Elizabeth University Hospital and the Royal Hospital for Children and Young People in Edinburgh. In addition, an oversight board led by Scotland's Chief Nursing Officer, Professor Fiona McQueen, will report on infection prevention and control practices at the hospital in the near future, together with the outcome of the independent case note review exercise. I want to thank the review team for their diligence in carrying out this report and the hospital staff for their focus on providing high-quality care throughout this challenging time.
Many thanks, Health Secretary. I'm going to move now straight to questions as normal. The first question today comes from Lucy White from BBC Scotland.
Thanks, First Minister. Just to pick up on your points on schools going back, at the moment, local authorities are getting in touch with parents, and some of them are being told that their child could be in school for as little as 1 day a week or 1 week in every 3 weeks. Just to ask you, is that good enough? And would you consider a Scotland-wide minimum for face-to-face teaching in school? And a related question, if you don't mind, just to ask how many former teachers have come forward since the Scottish Government asked them to in the middle of last month?
We'll get you that last number. I don't have it in front of me right now. On the first part of your question, the examples you've given me there, I'd say very clearly, no, I don't think that is good enough. I said very clearly in my opening remarks that we have to start from a point of seeking to maximise, absolutely maximise the amount of time children will spend in a school environment having face-to-face learning with their teachers. Now, while we have necessary safety constraints in place, that will, for a period, mean that that is not 100% of time being spent in school. But one of the things we will be looking at as we scrutinise council plans, which, as I said, we will do, is whether there should be a minimum that we seek to have. And that's work we will consider in the days ahead. But let me be very clear about the second part. We have a plan that we intend to take forward to open schools on the 11th of August, and we want to get to that maximum face-to-face learning position for the 11th of August. But that's not the end point. That is the starting point. And part of what has to be done from 11th of August onwards is build confidence amongst parents, teachers and young people themselves that schools are safe places to be. And we also have to look at the emerging evidence, which will be changing all the time, on transmission rates, particularly on what the evidence tells us about transmission in schools or amongst young people. And we will be looking, and this is something, as I said, we will ask the Council of International Education Advisors to help us with. We'll be looking at experience in other countries. So that 11th of August point, which we want to be maximised, will be the starting point. I want to get as quickly and as we can and as quickly as is safe and feasible back to a position where young people have normal schooling just as quickly as possible. And that, I know, is a focus of local authorities, and it will be a focus of the Scottish Government working with local authorities. And my last point would be to repeat the point I made before. Councils have a duty, and I know they take this very seriously, to be creative and innovative about how they use the totality of the resources that are at their disposal right now to reach that maximum position for the 11th of August and then to build on that. But where there are genuine issues of resources, the Scottish Government also has a duty to work with local authorities to address that, and we will do that in absolute good faith. The priority for all of us must be the highest quality education for our young people, and as we go through this period and out of this crisis period, to do everything we may be required to do to ensure that any impact on children's education does not adversely affect them in the longer term. And I cannot stress enough how important that is to me personally, but how much of a priority that will be for the government as we come out of this crisis. Ewan Petrie from STV.
Thank you very much, First Minister. I just want to pick up on a few points there. You mentioned in your opening remarks it wasn't the case you were planning for blended learning to last a whole year. Just to be clear, are you therefore expecting all pupils to be back full time before the end of the next academic year?
That's what I want to be the case. Let me just try and be as frank and as clear here as possible. One of the things that is inescapable right now is that we don't have a crystal ball that allows us to know with certainty how this pandemic will evolve and develop over the months ahead. As the Chief Medical Officer has just said, we know that there is a risk of the virus resurging in the autumn and winter, and we know that there are other risks that we always face in autumn and winter. So we cannot stand here at this vantage point and be absolutely clear that we will not face renewed risks from the virus come the tail end of this year. But we will be doing everything in our power to keep this virus suppressed and get it as close to elimination levels as we possibly can. And that frankness is just important for me to express, because parents, I think, understand that. But there has been a suggestion that I've seen put forward by some in the last couple of days that we are somehow planning as if blended learning for the entirety of the next academic year is inevitable. And I just want to be clear today that that is not the case. We can't rule out this virus having impacts that are inescapable, but our planning assumption is to get back to normal schooling as quickly as possible. And that means, firstly, maximising the degree of normality for the starting point of August the 11th, and then as we build confidence, as our evidence base grows, as we hopefully get more assurance about the risks or hopefully relative lack of risks in schools and amongst young people, then we can build on that position as quickly as possible. But let me be clear, I do not want a situation to exist for a minute longer or a day longer than is necessary where children have anything other than a normal school experience. And that, getting back to that normality as quickly as it is safe to do, is the absolute focus that we will bring to bear on this. James Matthews from Sky.
Thanks very much, First Minister. The 2 metre social distance is a factor, obviously, in education and for the whole economy. You know, you have sectors screaming at you to reduce that 2 metre distance. You've said it's subject to ongoing review. Can you tell me exactly what work is ongoing with regard to the 2 metres? What's being looked at? What are the factors that would cause a reduction in that? And what sort of timescale are we looking at? And if I may, can I just ask the Cabinet Secretary for Health, you said that families of people who died in the QEU deserve answers to their questions. Kimberly Darrett, the mother of 10-year-old Millie Main, said she's disappointed in this review. They were never spoken to as part of it. They hoped it might help them understand why their daughter died, and they feel they're still in the dark. Your opponents are also criticising you for your initial resistance to a public inquiry. What do you say to your opponents and to the mother of Millie Main?
I'm going to hand over to the Health Secretary on that point, but can I just firstly say, for my part, to the mother of Millie and indeed to any parent who has concerns or whose children has been affected by circumstances at the hospital, that there is a determination to make sure that they get answers as far as that is possible. And that's why the public inquiry, which this report will feed into, is so important. But the Health Secretary will address that point more directly in a second. On the 2 metre, 1 metre debate, which, as I keep saying, is important. I recognise the practical importance of it for many different interests, commercial interests, business interests, and indeed for some of the things that we're grappling with about school education. But it's really important that it, or any other single aspect of trying to suppress this virus, is not looked at in isolation. Now, I haven't set a timescale because I will be seeking ongoing advice as evidence emerges from the CMO advisory group and others about whether and to what extent in future it might be safe in some circumstances, if not in all circumstances, to reduce that limit. And I may say more about that this week as we outline the decision about whether or not we're going into phase 2 on Thursday. But it is really important that people understand, and I think people do understand, that these are not issues that we come at lightly. Given the practical difficulties that a 2 metre physical distancing creates for people, if I thought it was safe now to move away from that, then I would do that, because I don't want these practical difficulties to be with us for any longer than is necessary. But there are a whole variety of things that we've got to take into account. And as I've said before, this is not a debate, unfortunately, that is about absolutes. It is not the case that 2 metres is absolutely safe. 3 or 4 metres would be relatively safer than 2 metres, and 2 metres is relatively safer than 1 metre. And if you reduce the distance, there are other things you have to consider about, face coverings, and also the amount of time it is then safe for people to be in that kind of proximity. So these are very important issues, and I absolutely understand that, but they are also complex issues. And, I've always expected that this phase that we're in right now would be difficult, a bit counterintuitively, because all the numbers are going in the right direction. But as we see the numbers go down, there is a tendency for all of us to think this virus has gone away, so let's just go back to normal. But the real danger in doing that too quickly or without the proper mitigations in place is that we allow things to run out of control again. So great care and consideration is required now, probably particularly now. And I know, though, that I have a job to do to continue to persuade people why certain restrictions require to be in place. And that becomes more important, not less important, as we start to restore some normality to everyday life. Jeane, do you want to address the points about the Queen Elizabeth?
Yeah, thanks very much. I met a large number of the families who have been affected by the situation in a particular part of the Queen Elizabeth University Hospital campus. And whilst I can't know how they feel, and some of the young patients who I also met, because it hasn't happened to me, I do understand, and I did see and hear the impact that had on them. So I take this very seriously. The independent review is one of 3 significant pieces of work underway to give answers to the families affected, but also to ensure that we learn the lessons for all NHS infrastructure build, large and small, and feed into the national centre that we are setting up to provide the independent expertise on design and build and maintenance that our major infrastructure in the health service in Scotland requires. Now, we've also made sure that through one of our senior clinical officials, there is ongoing liaison with those families. So I appreciate that for many of them, reading this report will not provide them with specific answers to the situation that they or their child faced, and particularly where they're in a position where they have sadly lost a child. The independent review would not be able to do that. But the oversight work, the independent case note review, and importantly, the public inquiry will all address those issues. This is one part of significant work that is underway to get to the bottom of all of this, to learn the lessons, but importantly, as far as we possibly can, with frankness and with candour, provide answers to those parents who have suffered so much.
Thank you. Peter McMahon from ITV Border.
Thank you, First Minister. First Minister, as you know, high streets in the south of Scotland, even before the coronavirus, had considerable challenges in terms of their survival. Now, with shops opening south of the border in England, people can travel from most parts of the south of Scotland fairly easily to shop in England at the moment. Doesn't the fact that you've decided not to reopen shops put high streets in the south of Scotland at a further disadvantage?
Look, I don't want high streets in the south of Scotland or any part of Scotland to be at a disadvantage, and I don't want them to be closed for any longer than is necessary. I want to just stress again today that all the decisions we are taking right now have safety and public health absolutely at their core. And that's not to say that we are not considering the economic impacts, but unless we get this virus suppressed and keep it suppressed, and therefore protect public health, we will not be able to safely and sustainably reopen our economy. So these two things are not in competition. They absolutely go hand in hand. I said yesterday that we will announce the Phase 2 review on Thursday, and I very much hope that on Thursday we will give a date for the reopening of our retail sector, our non-essential retail sector that has been closed, because I want to see that happen as quickly as possible. But it has to be safe. I said in reply, I think, to James's question there, that in some ways this period that we are going into right now, not that any aspect of this has been easy for anybody up until now, but in some ways this next period is really difficult. And it will really challenge my ability to persuade you, the public, why we have to have certain restrictions still in place. Because we do see the numbers and the data all going in the right direction. So the tendency is to say, why can't we just immediately go back to normal? And believe me, I'm not immune from that. I feel that too. But the reason we're seeing all this progress right now is because of the lockdown restrictions. So as we come out of those lockdown restrictions, the real danger, and it is a real and present danger, is that things start to run away from us again. And we see some signs in some other countries of concerns emerging like that. So the key point here is that we have to do it carefully, we have to do it safely, and we have to make sure we are putting in place all of the mitigations along the way, because that is the route, not just to the quickest possible reopening of our economy, but to the sustainable reopening of our economy. Because the last thing I want to do is announce 1 week that something can open and then find 3 or 4 weeks later that has led to things going in the wrong direction, and then we're forced to close them down again. So if it feels that we might be going just a little bit more slowly right now, that is because the prize of doing that now is a more sustainable reopening with a much firmer foundation in the medium term. But trust me when I say I do not want anything to be closed any longer than is necessary. I want this country to get back to normal as quickly as possible, but I want above all for it to do so safely and sustainably. Alan Smith from Bauer.
Thanks. Thank you, First Minister. The leader of Dumfries and Galloway Council has today told our station West Sound that what they'll be able to offer pupils will be constrained by what the council can afford. Now, today you've said that the Scottish Government will scrutinise council plans and make resources available if identified. So can you set out details of how that will work? For example, if there's a difference of opinion between what the council thinks and what the Scottish Government thinks? And a question for the Health Secretary, just following on from James's question about the Queen Elizabeth Hospital. As he mentioned, the family of Millie Mayne haven't been interviewed as part of that independent review. Have you been given any reason as to why they haven't been interviewed, and is that something you would have expected to have happened during this part of the review?
I'll hand over to the Health Secretary on that in a second. Let me address the schools point. And I suppose I'm speaking now, not just to parents and young people out there, but to local authorities. We're all on the same side here. I believe that we want to restore normality to children's education as quickly as possible and as safely as possible. And that means us working together constructively. There will always be tensions between local and national government, just as there will always be tensions between Scottish and UK governments about funding issues. That's part of the way in which these things work. But we shouldn't allow this. And I give an assurance from the Scottish Government that I will not allow this from our side to become just a tussle over money. Councils really must, and they have a duty to, and I know that they take this seriously, to look within their own resources and to apply innovation and creativity, to look at where they, for example, have alternative buildings that they could use. And I know they are doing that, and they have to be encouraged to do that to the maximum. I have a duty, and the Deputy First Minister, as Education Secretary, has a duty to work with councils to say, if you are genuinely struggling with resources and need additional resources here, then we have a job to make sure that is provided. And if we both come at this from the only thing that should matter in this discussion, which is how we ensure the highest quality education for our young people, then I think we'll get where we need to be. So I promise and give an assurance from the Scottish Government that that's the good faith in which we will conduct these discussions, and I hope and expect that councils will do likewise. The only thing that matters here is making sure we get back to normal for young people as quickly as possible, and that also we work together to address any impact, any unavoidable impact that there will have been on children's education so far, so that this generation, and you know, I feel this so strongly, and as I know every parent and teacher and every individual will across the country, this generation of young people in Scotland cannot pay a long-term price for this unavoidable health crisis that we've lived through, and we must all resolve to do everything in our power to ensure that they don't pay that price. Jeane.
Back last year when the independent review was commissioned, it was really important that it was truly independent of government, and that having been given the remit by me, which it had, that it determined for itself how it would go about looking at the evidence available to it, who it would talk to, how it would reach its conclusions. And it has undertaken that work, I think, in a very thorough way. Now, I understand that there may be, as well as Millie's mum, others who feel that they should have had more time with the review, or they should have been spoken to by the review. I can't control what the review did. They did the best job that they believed they could do, given the remit that they had. What is important is that where there are specific answers that any parent wants on the particular situation that their child faced, particularly where their child has died, that the independent case review is able to talk to those parents, go through the case with them, and that is independently led, goes through the situation with them, look at what happened in that particular case and try to give answers. And the public inquiry, of course, will want to reach out to and listen to all the parents who've been affected in different ways by this situation, and give whatever answers it can in the fullness of time.
Thank you. Fraser Knight from Global.
Thank you, Minister. Many parents will be understandably worried about a part-time return to school for their children. They'll have concerns over childcare, or whether they can even return to work if they need to stay at home and look after their children, or indeed teach them at home. I was just wondering if the Scottish Government will issue any guidance, or even go as far as introducing legislation to prevent employers from discriminating against or for targeting workers when it comes to this.
Well, as I've said already today on a number of occasions, we do not want this part-time blended model of education to last any longer than it has to. And even from the starting point of August the 11th, we want the home part of schooling to be minimised so that the in-school part of education is maximised. And the principal objective for that, of course, is children's education, but I absolutely know the knock-on effect on parents' ability to juggle work life with childcare and homeschooling is extremely challenging as well. So that is a secondary and very important issue why we don't want this part-time model of education to last any longer than it has to. In the interim, while there is an element of blended education, yes, we will look at what we can do to work with employers to make sure that they are flexible in how they deal with their workers, and we will take those discussions forward, that there will be there are a range of ways in which we are asking and expecting employers to be flexible given the crisis that we're still dealing with. For example, if somebody is asked to self-isolate under the test and protect system, then we want employers to respect and recognise that. And similarly, if members of their workforce have childcare challenges because of that, that would apply there too. So we will look at all options for ensuring that employers, as they have been, and this is not a criticism of employers, everybody's been playing their part, but that employers continue to play their full part in getting us through this crisis and out the other end, back to normality. Tom Eden from PA.
Thank you, First Minister, and good afternoon. Today, Holyrood's Education Committee has written to the SQA with sort of numerous concerns about the exam replacement plans. One of the key concerns of this is the mountain of additional workload they'll be required to undertake, with potential appeals against grades coinciding with preparation to open schools. And obviously the Education Secretary says schools should be working to prepare pupils as if the exams are going ahead, but simultaneously gathering evidence in case exams are cancelled next year. And all this is alongside trying to make blended learning work. I was wondering if you were comfortable with the SQA's plans and what potential practical reassurances you could offer teachers who are concerned about the workload.
I know how hard the SQA is working to make sure that the plans in place are robust and that they do everything possible to ensure that young people are not adversely affected as a result of the different approach to exams that we've had to take this year. I've not seen the Education Committee's letter. I will look at that. If it is a letter to the SQA, I think it is appropriate to allow the SQA to address the questions that are there. But we recognise almost in every aspect of this, the impact on children, the impact on parents, including their work life that I've just been talking to in response to Fraser's question, the impact on teachers. This is, like every other aspect of dealing with this pandemic, none of it is ideal. None of it is what we would choose. What we have to do is work through as best we can so that we mitigate as far as we can all of those impacts, and most importantly of all, make sure that children's education is not adversely affected. I don't want in any way to underplay or minimise how difficult that is because of the challenges that are posed through that. But that is the duty I have, it's the duty councils have, and teachers and parents and all of us working together to do that. And there's an absolute commitment that we will do that. And if there are things we have to change along the way, if there are resources we have to bring to bear along the way, then all in the interest of giving young people the best education that they need and deserve right now, we will do that, and we will look at all options to make sure that that happens. Christine Lavelle from The Sun.
Thank you, First Minister. The Children's Commissioner, Bruce Adamson, has warned of the lifelong consequences of the lockdown on young people. He called on the Scottish Government to make children's futures a priority by investing more in mental health services. Can you outline what extra support's been put in place and what more do you think that you need to do?
Well, I'll come back to mental health in a moment, but Bruce Adamson, the Children's Commissioner, is right to point out to the risks that lockdown and dealing with this crisis poses to the long-term well-being of this generation of children and young people. But what I want to be clear about is that I do not and will not, I refuse to see that as inevitable, because I don't think it has to be inevitable. Now, that puts a huge onus on my shoulders, on the Scottish Government's shoulders, and on all of our partners who collectively have to work to make sure that children don't suffer that long-term adversity, to make sure that we bring to bear the resources and the interventions to avoid that happening. And that's, I suppose, of all the things I want to say today directly to parents and young people, is the impact of this on young people is obvious. You are seeing it right now. I'm not a parent, but I have a school-age niece and a school-age nephew. I've got another nephew who's about to leave school to go to university. I see that impact. But in terms of the medium to long term, young people bearing the legacy of that is not inevitable, and we should not see it as that. So we must be prepared to look at everything that we need to do to level again that playing field for this generation, and I am personally committed to that. In terms of mental health, you will have heard over the course of this epidemic, us talking about the additional resources that we have dedicated to mental health services to try to make sure that the additional demand caused by living through lockdown can be catered for. But going into this pandemic, we had a very wide-ranging, ambitious programme of reforms around children and adolescent mental health services, from the creation of a wellbeing community wellbeing service to try to focus more on prevention and early intervention around mental health, and also investment in CAM specialist services to make sure that those who need that specialist support get it. And that longer term programme of work, already backed by significant investment, will continue because it is hugely important. It was important before this, but it is even more important now as a result of this crisis. Do you want us to say any more about the CAM's work?
I want to add a couple more points, if I may, First Minister, and that is a lot of the work that has been resourced and undertaken in the pandemic so far on mental health and wellbeing support for children and young people, including through Parent Club, but in other ways, we intend to continue and to build on some of the innovative and creative ways that has been delivered and has proven to be effective for those young people involved. As the First Minister said, the commitments that were there pre the pandemic remain, and my colleague Ms Hockey, our Minister for Mental Health, will set out for Parliament this week how she is leading the remobilisation of our mental health services for adults, but particularly for children and young people, building on the continuation of the work that was secured as we address the immediate challenges of the pandemic, but also making sure that we remobilise where that is needed, particularly for children and young people.
Gina Davidson from the Scotsman.
Hi, good afternoon, First Minister. There's obviously been a lot of focus on what's going to happen when kids return to school in August, but before then, parents, especially those who are working from home, have got 6 weeks of the summer holidays to deal with restrictions in place and kids not able to go anywhere or do anything. At the moment, those children who are receiving work from school at least have something to focus on during the day. What is the government planning to do to help parents over the summer holiday period? What will be available for children and teenagers especially, who will desperately be wanting to go out and see their pals and hang about and do the things that they would normally like to do? I just wonder what advice the government is planning on giving parents and what facilities might be able to reopen for these kids.
So I think, it's a very important question as we face what would be the normal summer holiday period, but there's a number of strands, I think, to the answer I would give. Firstly, in terms of formal facilities and resources, there's consideration in government with councils in a number of ways to try to ensure that over the summer there are the appropriate services in place. In particular, as we indicated when we set out the route map and went into phase 1 of that route map, we want to increase the provision, particularly for children of key workers and what we describe, it's not a term I always like, but what we describe as more vulnerable children, into the critical childcare hubs that have been operational throughout this period, and for them to run throughout the summer. But there's also a wider strand, I suppose, which comes back to the more core decisions that we will take firstly this week and then 3 weeks from now, about how we emerge from lockdown, because we want to try to get as much normality back into lives as possible, making the obvious points that I always stress about the need to continue to suppress the virus. But that's why I hope on Thursday that we can take another step out of lockdown to get a degree of normality back, which is important for everybody, but I think we all recognise it's particularly important for young people who, not just over the past 3 months, have had to be away from school, but have been denied the normal contact that young people enjoy and value, and as part of their growing up with their friends and their peers. So and so much of this, the difficult thing, it's nowhere near as difficult for me as it is for those of you who are dealing with. But I so badly on all of these things just want to have a magic wand that I can wave and make all of this go away and get us all back to normal. Unfortunately, I don't have one of those. So we need to work our way through this as sensibly and as carefully and as I guess, with as much momentum and purpose as we can, and that's what we will do, trying to deal with these practical issues along the way. But I know from a parent's point of view, as you go into the summer holidays, that this will get more difficult, not less difficult, and the obligation on us to try to help with that becomes even greater. Tom Martin from The Express.
Hi, thank you, First Minister. Just going back to the issue of time in school, this morning on GMS, Mr Swinney suggested the objective should be trying to get 50% of time spent in class. Is that the starting point from August? And secondly, just on this issue that was briefly touched upon about minimum standards, the Coronavirus Act gives ministers power to issue educational continuity direction to councils. Is that something you're open to using to set a minimum standard to prevent a postcode lottery?
I hope we don't need to use legislation in that way, but we will always look at, and I'm not just talking about education here, generally anything we need to do to protect the public from the risk of coronavirus and help our recovery from it, we'll use whatever powers we have in appropriate and proportionate way. But I think with the Scottish Government working with councils, all of us coming from the same starting point here, which is to maximise the quality of children's education, then I think we can get there together collectively, and that absolutely is my intention and preference. I don't want to set a ceiling at this stage on the percentage of time that children will be in school starting from August the 11th, because I want that to be maximised. I would certainly, I think, have concerns about anything that was under 50%, although different councils will have different circumstances, but we want to maximise that. But I suppose the most fundamental point I'm making right now is that the 11th of August has to be a starting point, and we build on that as quickly and as safely as we're able to do. It's a point I make regularly in different contexts when talking about coronavirus, that our knowledge and understanding is developing all the time. One of the big frustrations we have right now is that we still understand too little about this virus, and one of the things we don't yet understand as fully as I would certainly like us to do is the transmission risks amongst children and just how big a risk factor schools are in terms of clustering events in the future. Hopefully in the weeks and months to come, our knowledge and understanding of that grows, and that will allow us to make different judgments about what is safe and what is not safe. And all along this way, we have to build confidence. There's no point in me looking directly into this camera and saying to parents and young people and teachers, schools are safe to go back to and you can operate them as normal, if you don't believe that. So it's about building that confidence and being very open and clear as we go, but being absolutely clear, and I'm absolutely clear that maximising the time children are in school is vital, and getting back to normal as quickly as possible is a driving objective, but it's got to be safe, and I think everybody would recognise and agree with that. Simon Johnson from The Telegraph.
You say you're willing to look at practice in other countries. In Denmark, where all children have gone back, they're doing social distancing of 1 metre between the children, but 2 metres between the children and staff. Isn't that a better balance in terms of protecting those respective age groups and maximising school time? And secondly, a lot of children, we can see it in parks, etc., play parks, so they're already, playing with their school friends. It's not, I know from experience, it's really difficult to keep social distancing among younger children. Isn't it a danger, this social distancing policy in schools looks a bit out of touch because it's not really taking into account the way in which pupils are already interacting outside the school gates?
No, I don't agree with that, but I do accept how alien and difficult all this feels right now. This is not normal life. It is not how all of us are used to living, and it's not how we want to live. I recognise, and it is absolutely the case, that social distancing, physical distancing becomes much more difficult the younger children are. We will publish later this week, I think, guidance on early learning and childcare, and that will be something that is very explicitly recognised in what we are advising early learning settings to try to do to keep children safe. I will always say this, whether it's to you, Simon, or to anybody who asks me the 1 metre, 2 metre question, as if it's an issue in isolation, that we cannot see it in isolation. It is a package of measures that we need to make sure we are deploying to keep people safe. And I would say, and it's not a criticism, because it would be you doing your job rightly and properly. But the way you asked me that question there is, aren't we just, and I'm putting, these are my words, not yours, but the kind of tone of it was, aren't we just overreacting a bit to all of this, and why don't we just allow kids to go back to normal? If we did that right now, and a few weeks or a few months from now, we had a serious outbreak of this virus in a school, I'm pretty certain, rightly I should say, so that's where I mean it's not a criticism, you would be asking me why we hadn't done more to protect young people. So none of this is easy. None of these decisions are straightforward. And all I would say to people, if you're frustrated, whether it's about 2 metre distance in a workplace, or blended learning for a period for young people, or not being able to go and visit your family the way you want to, all I would say to you in sort of addressing that frustration is this: I'm frustrated with all these things too. I don't want us to be living like this. So the fact that I am saying to you that we still need to have restrictions in place and that we still need to exercise a degree of caution should tell you that I'm worried enough about the implications of not doing that to tell you it's necessary. And, you know, I fully expect that over these next weeks, you know, I'm going to have to work even harder than I have over the past 3 months to persuade you of why certain restrictions are still necessary when you hopefully continue to see the data all declining. But I will not keep, and the government will not keep, any of these restrictions in place for any longer than is necessary. This is about stopping people dying, stopping people getting this virus, because even those who don't die from it, there is emerging evidence it can do long-term health damage. This is a serious, serious virus that does real damage, and we cannot be complacent about the impact of that when we still have so much to learn about how it behaves and who it impacts and in what ways. So please understand that if I'm being cautious here, it's not for no reason. It's because I desperately don't want to be standing up here reporting death numbers or case numbers any longer than I absolutely have to, and I know nobody wants me to be doing so either. Rachel Watson from the Daily Mail.
Hi, First Minister. Just quickly on the 2 metre rule, today we revealed in the paper that the government's advisory committee had said that there was little to no evidence that the 2 metre rule in schools will have an impact on the transmission of the virus. So if that is what the advisory committee believe, why is it that that will stay in schools then? And also, you talk about maximising time in classrooms for children. Would you look at cancelling other school holidays, such as the October break, to give children more time in class?
I'm not ruling anything like that out. Now, I'm not going to speak for the advisory group. They will sort of make their own views known. I will hand over to the CMO to say a bit more about this. But right now, when experts say there's not enough evidence of something, it often means it's just because we don't yet know enough about this virus. It doesn't mean that there is evidence that something is safe. And I think that's the context we've got to understand. You know, we don't, as I keep saying, 3 metres or 4 metres or 6 metres in some contexts would be the safest thing to do. And we know that 2 metres will have less risk than 1 metre. So it's about taking these things in the overall round and trying to make sure that we are minimising risk. We can't eliminate risks from this virus, but minimising them as much as possible. And I'm going to be pretty frank here. I think that particularly while we still know so little about this virus, that's particularly important where children are concerned. And again, just like I said to the Daily Telegraph, if I was to be nonchalant about the risks that children face right now, and if I was to say, do you know what, we don't really understand this virus right now, but I'm just going to kind of take a chance, take a risk that if we reduce it to 1 metre in schools, everything will be fine. And then a couple of months from now, there's an outbreak in a school. Papers like the Daily Telegraph and the Daily Mail, rightly so, would be queuing up to rightly ask me why we hadn't taken greater care. So I'm going to err on the side of caution when it comes to keeping people safe from this virus. And that will be particularly true when it comes to keeping our children safe from it. Gregor.
You know, we use this word risk all the time just now, and I wonder whether we ever kind of stop to think what we mean behind that phrase when we talk about risk. Because when we talk about risk, the risk we're talking about is that virus spreading from one person to another, and that might be a child to begin with, but that child might go home and they might spread it to another member of the family, and for some reason another bridge of transmission might form and it might spread to an older member of the family, and of course the consequences of that might be even greater. The bottom line is that risk has real meaning. And when we talk about children and when we talk about the distance, there are so many different factors that we have to take into account when we're assessing that risk. So it's not just about the physical distance that exists between two people, be they children or adults, but it's how much time they spend in each other's companies, whether there's moments where they have closer contact or direct contact. It's moments whether they have the ability to able to comply with the other public health measures, such as making sure that they're cleaning their hands regularly as well. And it's also how they're affected by this virus and the disease that lies behind it as well. All these things need to be taken into account when we're assessing a simple rule such as distancing. And it's a continuum. Risk is a continuum that we must take all these factors into account for. And as the epidemiology of this disease changes, that risk will change as well. And as there are fewer and fewer cases of this that occur around about the country, different decisions may be able to be made. But at this moment in time, we're not at the stage yet where we can make those decisions.
Thank you. Derek Keeley from the Courier.
Thank you, First Minister. 2 weeks ago at the Daily Briefing, you said it was not your intention to have any kind of penalties or sanctions for parents who are concerned about safety and decide to keep their children at home when schools reopen more fully in August. But yesterday, the Deputy First Minister said it will be a legal requirement for parents to send their children to school, regardless of any anxieties about coronavirus. Could you explain that apparent change in position, please?
John was stating what the law is. I will continue to state, as he would, that we don't want to be in the position where parents are feeling that it is not safe to send their children to school. And that is why we will put so much focus. I've set out today very clearly the expectations of the government about children's education, but I've also been very candid that part of getting us there is to build confidence of parents and teachers and young people themselves. Because I can, even if I go through a process over these next few weeks before the 11th of August of convincing myself that a certain model of education is safe, if I can't convince you, the parents, that it is safe, then we won't get very far. So this is not something that I think we should see as Scottish Government versus local authorities, or local authorities and Scottish Government against parents, or parents against. We all come at this from the same point of view. We want children to have the best education we can give them, and we don't want them to be disadvantaged by this pandemic. So I see this very much as us working together, of us making sure we're bringing to bear the best evidence, that us and councils are working together to make sure we're bringing all of the available resources to bear on this, and along the way us being able to convince parents, young people and teachers that schools are safe places to be. So let's not really start in this as some kind of adversarial, financial or other penalties that will be brought to bear on parents, or having Scottish Government and local authorities at loggerheads. Because if we do that, that misses the point of what's best for our young people, and that should be the only principle that drives us right now. Tom Gordon from the Herald.
Hello, First Minister.
Hi.
Hi there. You've mentioned the relationship between central government and local government in reopening the schools, but the other big party you haven't mentioned are the teaching unions. Have you found the unions have been showing the creativity and flexibility the situation demands? And on a related point, do you think there might be merit in opening schools on a Saturday, at least in the initial period when a lot of the work will be essentially remedial?
So a bit like my answer to the October school holidays, I don't want to rule anything out if there is a case that can be made for it helping us to deal with the challenge we're facing. But equally, that is not me ruling that in either before anybody decides to run away with a headline. We've got to consider all of these things properly and in the round. On the point about the education unions and teachers, you're absolutely right. That is, they are a key partner as we get schools back to normal. And I firmly believe, and have no evidence to suggest otherwise, that teachers, including their trade unions, want the same as all of us want, which is to get schooling back to normal as quickly as possible. But teachers are also parents themselves. They have families of their own, and it is not unreasonable for teachers to want to be assured and to have confidence that schools are safe. And I don't think that is unreasonable. So let's all work together. been very clear what the objective is, to get normality back to schools as quickly as possible, to maximise the time young people are in schools, having face-to-face learning, and then work together to get there. And I think we all want that, and if we all come at that with good faith and with that objective in mind, then we will make progress, albeit with a set of challenges that are difficult for reasons we all understand. Kieran Andrews from The Times.
Thanks very much, First Minister. All being well, we'll be moving through the stages of Phase 2, tail end of this week, and Phase 3 in the middle of July. The reopening of the economy hinges on people being able to go back to work. I wondered how that will be possible when nurseries are going to largely remain closed until later in the summer, and there'll be some form of blended learning till at least August that employers don't have an end date for.
Well, look, I touched on this a little bit in an earlier question. We have to work our way through all of these things. As I said earlier on, I wish I had the magic wand that could make all of these pieces just fall into place straight away, but that's not the position we are in. There are interdependencies between all of the different parts of the route map, and that's something that we have in mind as we are taking decisions about entering a new phase and what aspects of that phase are possible and what might not be possible. So the interdependency between education, early years education and school education and parents' ability to go back to work is one of those. The interdependencies between opening up, for example, the retail sector and having the capacity on our public transport is another. All of these things we consider very carefully, and we have to work, as I indicated earlier on, with employers to continue to show flexibility. And where it is still the case, and it will be the case for the foreseeable future, that where it is possible for somebody to work from home, they should be supported to work from home. So I'm afraid none of these things are straightforward and challenge-free. We all know that, but the responsibility of government is to steer a path through that tries to deal with and mitigate as many of these difficulties as possible, and that's what we will continue to try to do. The last question today is Paul Hutchin from the Daily Record.
First Minister, you've been clear on a number of occasions that your top priority in government is to close the poverty-related attainment gap. Do you accept that there's a real danger in relation to blended learning, even if it's in place for a few months, that gap might widen rather than narrow?
Of course I accept that danger. You know, I don't want to sound glib here, because no aspect of how I go about dealing with this is glib in any way. But, you know, I wouldn't have chosen to have a pandemic in terms of the work we are doing, already difficult work, challenging work to close the attainment gap and raise standards in our schools overall. So it is absolutely unavoidably the case that if we are not careful and if we don't work as hard as we will need to work to avoid it, that this pandemic can have long-term effects on children's education and a whole range of other factors as well. But I'll come back and I'll end on the point I made earlier. I'm not prepared to accept that that is inevitable, because that would be letting down this generation of children and young people, and we shouldn't do that. So instead of saying we've had a global health pandemic and we accept that there will be an impact longer term on children's education and the attainment gap, I'm coming at this from what do we need to do to make sure that's not the case. Now, that is the way I've expressed that there masks a lot of very difficult challenges that will be involved in making sure that that is deliverable. But that's the place I come from in taking this forward. I don't accept, and I'm not prepared to accept, the inevitability of this generation bearing a longer term burden of this crisis that we've lived through. And I'll do everything I can, work with all of the partners we need to make sure that we avoid that at every single turn. That concludes the questions today. Can I end where I started, just directly to parents and young people? I know that of all of the impacts that this crisis has brought to bear, the anxiety, particularly as we go into the summer holidays and start to look ahead to a new school year, the anxieties about the impact on young people, on schooling, on education is significant and acute, and I want to recognise that. But I want to repeat the personal assurance I gave earlier on that we will do everything we can to mitigate and to minimise that impact, to address it longer term so that it is not an inevitable longer term impact, and to make sure that we are getting schools back to normal as quickly as possible. We'll be frank along the way about some of the uncertainties and the challenges we face in that, but that is the objective, to make sure that we do not have any period of time longer than is absolutely necessary that children are not in school as normal. And I will continue, as the Deputy First Minister, will to keep you updated on that as we go through these next few weeks. My thanks to Gregor and to Jeane. My thanks today to Jill for interpreting for us and making sure this update has been accessible, and my thanks to all of you for continuing to tune in and to continuing to think so carefully about what all of us need to do to make sure that the progress we are now seeing continues and that we don't jeopardise it through the impatience that I know we all feel to get back to normal. We are absolutely going in the right direction, and if we stick with it, we will get there more quickly, but we'll also get there more sustainably than we will do if we give in to the inevitable frustrations that we all feel. So my sincere thanks to all of you. I'll be back here tomorrow at 12:30 for tomorrow's update, and in the meantime, thank you very much.